So, good evening, my dear doctors. I hope I am audible and visible. Okay. So, as we have promised that every Friday we will be discussing one important diagram. And if you read Guyton or Ganon, so good evening, my dear doctors. In both, I hope you can see a diagram and which is showing how insulin is released from the beta cell. Okay. So, how insulin is released from the beta cell, this can be understood by a simple diagram. So, listen very carefully. It is a very short session. So in that short session, I'll be discussing how whenever we are having food, okay, ultimately all the carbohydrates will be broken down into simply glucose. And whenever they are entering in the beta cell, automatically what will happen? By which glut they will enter the beta cell? It is the glut 2. So beta cells are having glut 2, okay, so glucose will enter the beta cell. And this glucose will be converted into glucose 6 phosphate. So glucose is converted into glucose 6 phosphate by, what is the answer? You know, glucokinase. So first of all, glucose will be converted into glucose 6 phosphate in the presence of hexokinase or glucokinase. Now, this glucose 6 phosphate, when undergo glycolysis, will be converted into ATP. This much is clear. So whenever any glucose enter inside the beta cell of pancreas, it is going to convert into ATP. Now, which channel is present on the beta cell? Second point is that which channel is present on the beta cell? Answer is ATP dependent potassium channel. So, which channel is present on the beta cell? ATP dependent potassium channel. So, whenever glucose is converted into ATP, automatically ATP dependent potassium channel will close. Okay. So, normally when you are not taking food, potassium channels are open and all potassium are going outside. But whenever we are having food, automatically what will happen? Glucose will enter in the beta cell, convert into ATP, and this will cause closure of ATP dependent potassium channel. Now this potassium cannot go outside. So what will happen? All potassium will be accumulated in the beta cell. And this accumulation of cation, and here it is potassium, will cause depolarization. So this is going to cause depolarization. And whenever there is depolarization in the beta cell of pancreas, this is going to open voltage gated calcium channel, and calcium will come inside, and this calcium will cause release of insulin. It is so simple. But this diagram is very important in your physiology as well as in pharmacology. Why? Because plenty of drugs, okay, like sulfonylurea, like GLP-1 agonist, they all are based on this single diagram. So please let me discuss step by step. So whenever we are having food, carbohydrate will be broken down into glucose. And whenever glucose enter in the beta cell through GLUT2, it will convert into glucose 6 phosphate, which will convert eventually into ATP. And whenever you are having ATP due to the glucose, automatically ATP dependent potassium channel will close. So automatically ATP dependent potassium channel will close and potassium cannot go out. And if potassium cannot go out, what will happen? Depolarization. So either cation is coming inside or cations cannot go outside. In both conditions, there will be depolarization. And depolarization will open which gate? Voltage gated calcium channel. So calcium will cause exocytosis of the insulin. So this is the mechanism of release of insulin. So one concept is how whenever you are having food, it causes release of insulin. This is a simple concept. But recently in one of your examination, they were asked, the release of insulin is monophasic or biphasic? The release of insulin is not monophasic, my dear doctors, it is biphasic. What do you mean of biphasic? Because whenever we take food, within 10 minutes, there will be immediate release of preformed insulin. Okay, so within 10 minutes of having food, automatically, what will be released? All of the insulin will be released, and that will be preformed. The preformed insulin will be released, and that is called as first phase. The first phase of insulin is because of the pre-formed insulin, and that will be happening within the 10 minutes. And after that, within 90 minutes, so from 10 minutes to 90 minutes, what is going to happen? The newly synthesized insulin is going to be released. The second concept for today Friday, every Friday we will be discussing one important thing. So first concept I have told you how insulin is released from the beta cell, and second important concept is how release of insulin is biphasic. So biphasic means the first phase will be pre-formed insulin, and second phase will be newly synthesized insulin. Is this clear? So this is about the release of insulin. Now a bit of the clinical input. Okay, this is about the release of insulin. Now only one thing I will tell you. There is a drug called as sulfonylurea. Sometimes they ask which drug is acting on ATP dependent potassium channel. Then answer will be sulfonylurea. So sulfonylurea are working on ATP dependent potassium channel. So what is benefit of giving sulfonylurea to diabetic patient? Because whenever we are giving sulfonylurea, automatically ATP dependent potassium channel will close, and this will cause release of insulin. That is why sulfonylurea are secretagogues. So in diabetic patient, the release of insulin is it can be less or it can be resistance can be there. So in those conditions, we are giving sulfonylurea for MBBS first year. This is sufficient to know that they are acting on which channel. And what is the answer? Sulfonylurea are acting on ATP dependent potassium channel. Let me summarize whatever we discussed just now. Number one, glucose entering inside the beta cell of pancreas can release insulin from the pancreas. How? By closing ATP sensitive potassium channel. Because glucose will convert into ATP, it will generate ATP, and the channel will be closed by generation of ATP because they are ATP dependent potassium channel. And this closure of ATP dependent potassium channel will cause influx of calcium. And we know the most important function of calcium is exocytosis of insulin. And second concept, the release of insulin is biphasic. First is the pre-formed insulin, and second is called as newly synthesized insulin. Is this clear? So all the very best. Meet you next Monday. Monday is for physiology concept. Thank you.